patient's blood pressure is 70 over 40. What are you going to do? Let's walk through it together. The first thing you're going to want to do is verify that that is indeed fact the patient's blood pressure. Now, we don't want to spend too much time on this because we don't want to be delaying any interventions for this low blood pressure, but it's okay to run another blood pressure or put the cuff on a different arm and verify, oh, yes, in fact, this blood pressure is low. As I'm doing this, I'm thinking, why? Why would this patient have a low blood pressure? Did they receive any maybe antihypertensive medications? Are they hypovolemic? Are they bleeding? I'm also going to be looking at has anything else changed? Like, what's their heart rate? Is their heart rate high? Typically, with low blood pressure, you'll actually see an elevated heart rate. Got it. Let's make sure the patient doesn't have any rhythm changes. Certain rhythm changes can actually cause low blood pressure. For example, your patient's in AFib RVR or SVT. We verify that blood pressure, we get a full set of vitals, and it indeed is 70 over 40. The next thing I'm going to do is look, what can I possibly do about this? Now, this varies depending on the area that you work in. If you're on med surg and your patient's blood pressure is 70 over 40, most likely you're going to be either calling a rapid response or calling the provider saying, hey, this is going on, and they're going to give you some orders. In the ICU setting, we tend to have a lot more medications and drips and things available to us that we can initiate. The two main ways to treat low blood pressure are fluids or medications. Quick fix is also laying your patient in Trendelenburg. By laying your patient back, you're kind of shifting that blood up to go more towards their core, which may temporarily give you just a little blood pressure boost, but overall, we still need to fix the underlying issue. If I have a pressor or something available to me that I can start or increase my dose on, that's what I'm going to do in the ICU. But if this is an unanticipated change for this patient, I am still going to be communicating this to the provider so we can come up with a game plan. Maybe that patient does need more fluids. Maybe we need to check a hemoglobin level because the patient's been bleeding and maybe they need blood products. There are quite a few reasons why someone can be hypotensive. But the one thing we're going to do is not panic.